Today we will discuss about the lung volume and the lung capacities. Capacities are basically the combination of more than two lung volumes. First we will discuss about the lung volume. First we will discuss about the tidal volume. Tidal volume is the volume of the air that can be inspired or expired with each normal breath. Second thing, the normal value of the tidal volume is the 500 ml. Second thing is the inspiratory reserve volume. Inspiratory reserve volume is the volume of the air that can be inspired above the tidal volume, and its normal value is 2 to 3 liters. Second thing is expiratory reserve volume. Expiratory reserve volume is the volume of the air that can be expired above the tidal volume, and its normal value is 1.2 liter. Last thing is the residual volume. Residual volume is the volume of the air in the lungs after the maximal expiration. It is the only volume that cannot be measured by spirometry, and it increases with age. Residual volume, and the normal value of the residual volume is 1.2 liter. Second portion of the topic is the lung capacity. Lung capacity is basically the combination of the two lung volume. First is the inspiratory capacity. Inspiratory capacity is consists of the inspiratory reserve volume and the tidal volume. Second is the functional residual capacity. Functional residual capacity is consist of the expiratory reserve volume and the residual volume. Functional residual capacity contain residual volume, so that's why it cannot be measured by spirometry. Vital capacity consists of the inspiratory reserve volume, tidal volume, and expiratory reserve volume. Last is the total lung capacity. Total lung capacity is basically the combination of the all four lung volume, and normal value of the total lung capacity is 4 to 6 liter. Let us take some overview of the obstructive and restrictive lung disease on the basis of force expiratory volume in 1 second and our force vital capacity. Normally force expiratory volume is the 80% of forced vital capacity. So normal ratio of the force expiratory volume over force vital capacity is 0.8. In case of the obstructive lung disease, this value is less than 0.8. because in this case force expiratory volume is more reduced as compared to the force vital capacity, so that's why this ratio should decrease to less than 0.8. In case of the restrictive lung disease, force expiratory volume is less reduced as compared to the force vital capacity. So in this case, restrictive lung disease, these ratio is more than 0.8. Let us discuss more about the obstructive lung disease. Basically, the obstructive lung disease basically leading to the obstruction of the airflow, which leads to the air trapping in the lungs, which ultimately lead to the increase in the functional residual capacity, residual volume, and total lung capacity. So let's discuss the most common causes of the obstructive lung disease are COPD and asthma. Now we will discuss about restrictive lung disease. Restrictive lung disease basically we broadly classified into the two classes: diffuse parenchymal lung disease, also known as the interstitial lung disease, which have a lot of variety of causes like pneumoconiosis, sarcoidosis, and other radiation induced injury. Second thing is respiratory mechanics, in which is further classified into the respiratory muscle weakness and chest wall abnormality. Respiratory muscle weakness include polio, myasthenia gravis, GBS, and ALS. Chest wall abnormalities includes scoliosis and severe obesity.